Welcome to this episode of People Are Animals Too, Darn It. I'm your host, Mandy Evans, and joining me today is an extra special guest. It's Melanie Sadek, the Executive Director of Valley Humane Society in California, and she is my twin sister. Welcome, Melanie.
Thank you.
So it will be hard for those listening through just the audio version to know who is speaking. This is Mandy. And so if you are hearing the more articulate twin, it's probably Melanie.
I thought you were going to say it's me.
I was going to, and then I thought that would be unkind and that I would throw you a bone. So Melanie and I were just talking about the changes that have happened due to COVID, and that just this quick response, and thought we could discuss it today in this podcast. So Melanie, before we get started, do you want to give the audience a little bit of background on yourself?
Sure. So I am the executive director of a private nonprofit animal shelter in the San Francisco Bay Area. And I've been with the organization for almost 10 years. Before that, I owned a retail store for a short period of time. And before that, I was in the highway safety world and worked for AAA. And in that kind of all of that experience, I've had the opportunity to really kind of work in the public health realm, understand change management and how to make an impact in your community. And then also the power of branding and marketing, and hope to, I feel like that's an area where I can add value in our industry, is just understanding all of those things and trying to help us kind of make some really sustainable changes to the industry we work in and gain buy-in from communities through kind of trust and empathy. And so I also have a background working with law enforcement in my highway safety days. And so I think I have a good understanding of some of the challenges that some of our public shelters face working as government entities. So yeah, that's me. And kind of, I think Mandy and I are fortunate that we are in the same industry because we can talk about work all the time, which is kind of fun and sometimes like, ugh, so can we talk about something else?
Nah. Okay, so let's just do a little recap of the year, because that's, what we all need. So back in, I think it was February or March, all of a sudden there was the stay-at-home order where really shelters throughout the country had to quickly figure out what they were going to do. And a lot of shelters chose to go down the road of putting all of their animals in foster and kind of sitting on the animals in foster for a little while, not really proactively adopting out, because they had to send their staff home or reduce the staff significantly. And then what happened next was really interesting. The Surgeon General came out and asked people to not perform any surgeries that weren't essential. And that included veterinary medicine and spaying and neutering. And then Dr. Julie Levy came out and really made a plea to shelters across the country and vet clinics across the country to really stop all spaying and neutering because of the drastic need for PPE in human medicine. So to really favor the human side and the human medicine, and that was the way that we could support. That's a big deal for people in animal welfare, to stop spaying and neutering. Melanie, did you guys stop? What did you do?
We stopped. So in California, our shelter in place started right around March 17th, and immediately stopped, though I have to say that I was not a proponent of stopping, mostly because I felt like if we already had the PPP or the PPE in stock, then why not just continue until we had to be in a position to reorder? And so there was a little bit of frustration that we were kind of being forced to stop. And we were being forced to stop because we lease out space, and they had chosen to stop all surgeries, so we didn't have a choice. But yeah, we had to stop until really it was until the California Veterinary Medical Association said that they felt that it was time for surgeries to start up again, which I feel like was in June or July.
Just a long time.
It was a long time, and we were still adopting animals out unaltered, and then just went back through. It took us 3 weeks to go back through and get all of those animals then fixed. And we were successful in doing that.
100% compliance.
Yeah.
Yeah. So we've heard there's been a little hubbub in our community because we did that as well. And people were really upset that we would adopt animals out that weren't altered. And we had 100% compliance as well. So I think that when you look at animal welfare and the years that have gone by where really spaying and neutering has become part of our culture, it really is part of our culture. We tend to put this belief system that, you know, people are somehow bad or irresponsible. But really what we see is that the vast majority of people want to have altered pets. They don't want to have an altered pet at home. So it's great news. We've done our work. Like, people really care about spaying and neutering.
Yeah.
So
and there's a benefit. There's a benefit to that because we're paying for that surgery. So I also think that plays into it. Like, okay, maybe one day I'm going to have to do this. Do I want to pay that full fee when I know that this organization is going to do it for me for free? And so we didn't get any pushback because there's a benefit. They not only do they value that surgery, but they value the fact that they need to take advantage of the opportunity to have it covered. It's illegal in California for us to adopt out animals that are not fixed. And so we definitely had to make sure that we knew what we were doing so that we weren't breaking any rules.
Okay. And then you did something a little bit different than the shelters around you. You continued to adopt.
We did. We got a little bit of pushback within our own industry for this, but when shelter in place happened right away, animal welfare was not marked as an essential business, which meant that there was an expectation that all of our staff would go home and we wouldn't come back to work. And so we felt like that was probably just an oversight, because how do you just take all these animals in a shelter and just say, oh, bye, I'll see you later. We were told that we can't take care of you. And so we had gotten a heads up a couple days before the order came in. And so we got all of our systems in place to start doing virtual adoptions. And so pretty much day one, we maintained our virtual, our adoption process. We continued to pull animals. We just were extremely safe and careful. And we've not had any COVID exposures that turned out to be positive. We've been able to maintain a really safe environment and have adopted out more animals this year than any other year since we've been in our building. So it's been very successful for us.
Wow, that's awesome. So here you've got shelters all over the country, and they're all having to pivot super, super fast. And so one of the things that happened was, I think it was America Pets Alive started this weekly call that was like their weekly COVID call. And you had about 250 shelter representatives on the call every week. And what's been cool about that is the sense that they're this coming together and really trying to solve problems collectively, and also just hear about the challenges. And it's interesting because there's some common themes, but everybody has their own challenges. We just talked to a shelter in Oregon, and that poor guy has lost a good portion of his team. And I know that we had some turnover in the summer. There's just been high emotions. That we provided counseling to our team because it's just been one of those years. Have you talked to shelters in California that have been experiencing some real challenges due to all the change?
I think in the very beginning, everyone was, in general, I think COVID's been very positive for animals. I hate to come up with some kind of positive when something so negative is happening, but I agree with you, like the national platform, the amount of communication and collaboration is kind of unheard of in our industry, and it's been really, really fantastic. But when you get down to kind of that grassroots level, in the very beginning, there was this overwhelming amount of support for these shelters. And I really believe personally that support came from a place of the community wanting and finally feeling like they had an opportunity to collaborate and make life-saving differences for these shelters. Like for some of them, they'd never even been asked to come in and support the shelter before. And they were supporting life-saving change, right? So they were going to get animals into homes, and they were going to open up space for animals that maybe through emergency kind of hospital placements, that kind of stuff, animals needed a temporary place to go. And so it was really, really positive. Well, as COVID has gone on, and I know it's not just specific to our industry, we're hearing it in the retail world, we're hearing it in veterinary hospitals, but people are kind of sick of this whole COVID thing, and it's making everybody on edge. And we're a kind of a world that's ready for the next fight. And so I think what we hear on our end is this, I'm just ready to fight with you. And so, hey, now all of a sudden you're not doing maybe what I think you should be doing. And so instead of really getting the facts and finding out why things are being done differently, people are just fighting. And I mean, there are, look at videos of retail stores and people are getting punched.
I know.
I mean, who would have thought that working at like a retail store was actually now a dangerous place to be? And so I think our industry is kind of getting some of that and feeling some of that pushback, and that is creating a lot of negative emotions for staff. They're feeling like, hey, I'm in this world because I want to make a difference, and now all of a sudden I'm becoming the bad guy, and all I'm trying to do is save lives and help, but also not get sick or not get my coworkers or my community sick. And so how is it that now I'm the bad guy? And so we have seen some of that. In California, we have animal shelter directors across the state who have given people a voluntary day off in November, just because we aren't sure what's going to happen with the election. I mean, shoot, this is after the election. We still don't even know what's going to happen with the election. And so, I think we're in a good place for animal welfare, but maybe not the best place as far as how our community is interacting, not just in our industry, but how we interact together as people.
Yeah. And then to add fuel to that fire, shelters have had to change. Like there are, I know for us, well, we had kind of like a perfect storm. So we had our, we live in a small community. So finding there's not an excess of professional talent in any given field. And so vet techs are really highly sought after. We have, I think, 5 vet clinics in our community. And then we need our own vet. We have our own vet, and we need a vet tech to be at the shelter because our volume is bigger than the independent vet clinics could support. And our vet tech, just her grandma is in California, and she just decided to move to be closer to family. So when that happened, though, that leaves us with no vet tech. And if you don't have a vet tech, you can't actually do surgeries and the things that you really need to do. And finding a vet tech is super hard. And then really just balancing your intake, that you can't just be open to to everybody and every animal that would like to come into the shelter. So it essentially has been like human medicine, where shelters, not just here, but all over the country, have had to prioritize the needs in their community to really be focused on those at greatest in need. So you've got your sick and injured cats and kittens, medical cases and behavior cases, and owner surrenders that literally have no other option, but they have to come in. All of those to come into the shelter. And I don't know about you guys, but we're regulated on how much sanitizer that we can buy right now. I just have had, like, we have no surgical gowns. We were able to order, I think, a few, and then we're getting a pattern so the community can help make some like real challenges. And then you add that on top of everything, and the community is just like, what is going on? And there's this, backlash, which you and I have definitely talked about, is this lack of communication from, and I'll own it, from our shelter on how you communicate these changes to the community successfully.
Yeah, I think that when COVID first started, we were so overwhelmed with the amount of support that the community was giving us that I kind of think that people in our industry even misinterpreted that, or I think in general, we forget that the decisions we make have an impact on the community. And so asking ourselves, how is this decision going to make people feel about the work we're doing, is important. And so communicating and over communicating becomes important. In California, we took a survey of some of our industry leaders just to ask them how they felt about our industry and how they perceived others felt about our industry. And one of the top responses was a sense of frustration that people don't understand that this is a professional industry, that we are regulated by veterinary practices, that there's an expectation that we're going to follow certain procedures. And so what frequently happens is our community compares our work to what's happening at a rescue level or even a home level. And so, well, why can't you bring in 1,000 cats? Duh, you have a huge shelter. Why wouldn't you be able to do that? Well, because to bring in 1,000 cats, we need to have the capacity to feed them, to take care of them, to make sure they don't get sick. We know that cats housed together are more likely to get serious illnesses and infections. We know that those are bad decisions for animals. And so as much as the community sees it and thinks, gosh, this is so dumb. I take care of animals at home all the time. Get with it. The more professional your organization becomes, the more that you grow, the more your decisions have to reflect those of the industry. And so we're following all these procedures by professional agencies. We're looking to leaders like Best Friends and our veterinary schools and leaders to tell us how we're supposed to do things. I mean, I'm sure you've experienced this, but when we have volunteers that go through new volunteer orientation, they're like, wait a minute, what do you mean I have to clean in this specific way and I have to do things this specific way? I just want to cuddle with animals, and maybe I have to clean up poop, but the amount of training that they need is so extensive. So I think that's an opportunity for us in our field, is to help people better understand how much science goes into our decisions. Because I think that the trust in any kind of agency like us is a thin line of trust. We can build up a huge community base that trusts what we do, but as soon as there's just a thin line between trust and not trust, and we need to kind of work on that. So yeah, it's definitely been a challenge.
Yeah. Well, and I think the other thing that happens is it's animal welfare. So even when times are really good, you just have people who are so immensely passionate about animal welfare, and they have their own beliefs on how animals should be not managed, but cared for, I guess. I mean, just we can talk about like community cats, and there are, there's an idea that community cats don't live full lives, but yet we know that through the University of Florida and everything they're doing with Million Cat Challenge and UC Davis and Wisconsin and everybody, that cats really haven't evolved as much as dogs. Dogs have become pretty reliant on humans, and cats really haven't. So they love their outdoor lives. They love being in their colony and their community. And we almost overhumanize this issue where we think that all cats should be domesticated, and it just isn't feline. Like, they want to be outside. And then there's cats that, our climate here is really can be very cold, and we do have a feral cat challenge here, and these cats figure out how to stay warm, how to get food. They have robust colonies here. So, but anyone that thinks that a cat should be really domesticated and be in a home, their belief of, trap, neuter, return, any of that can be skewed from that belief. Whether the science says leave them alone or not, the emotional aspect is so strong that it tips them into the getting very angry camp.
I think that if we remember that we are in charge of very vulnerable population, like, we have to be the voice for these animals because they can't speak for themselves. And so, people they're passionate about fighting for their rights because they don't feel like they have any other voice except for our voice. And so sometimes, instead of just listening to the logic, it becomes the argument of like, I have to do my job to fight for this animal. But oftentimes we're fighting the wrong battle. And so, like, in our area, when we have, people will bring us a box with little tiny baby kittens. And they think they're doing the right thing because they think they're abandoned. But what ends up happening is that kittens can fail to thrive. And so, first, those neonate programs are very labor intense. Like, every 2 hours, those kittens have to be bottle fed. Now, we're not talking one kitten. We could be up to 6 to 9 kittens. It's so much work. And then to have the kittens just one by one die, no matter how much work you've put into it, it's so deflating and emotionally taxing that we can't even keep volunteers in the program because they are just devastated. And so the best outcome for those kittens is to stay with their mom. And so some people just can't even understand why we would ask people to try to put them back where they found them. Keep an eye on them, make sure the mom does come back. But their chance of actually living a full life is greater when we can leave them alone. Now, once they get older, I've heard of people that are trapping feral cats and trying to create an indoor cat out of them, and the cat hides under a bed for the rest of its life. You have to ask yourself, is that the quality of life that animal deserves? And so I wish we could get to a place where everyone understood that we were all on the same team. We're all trying to fight for the same thing. We all want great outcomes for these animals. We're just trying to get the best information we can get to create that positive outcome. And, Dr. Kate Hurley, she's really pointed out, she's from the UC Davis team, and she's pointed out that we don't even know how many cats are out there, that we do see certain colonies, but that there are thousands and thousands of cats that we are not even aware of. And so her position has always been, why would you grab a bunch of cats just to euthanize them, which is a problem in California. We euthanize a lot of cats. And so if we can't bring them in and provide positive outcomes, then leave them alone, because their chance of being successful is so much greater. And it's just a hard message to get out to people who feel like we're somehow just abandoning these animals.
Yeah. And then also you have to add in the fact that community cats can be a nuisance. pee and poop in people's gardens. They're, this is not much of an issue here, but they walk on clean cars. Where I live, people don't wash their cars. Well, they do. I just don't. So it's hard, that balance of what needs to be done. And we started our community cat program years ago, and we've made really great strides. And to not be able to, we had to pause our TNR program. It's still paused, but I'm hoping we'll be able to get it up and going again in January. And that's hard for us. Like, we started that program and we were really proud of the progress we've made. And it's such a great community partnership program. The community members are bringing them into us. We alter them, they bring them back. It's just been this really great, successful partnership. And to not do that. But then Dr. Julie Levy from University of Florida ran some numbers and told us, chill out. It's okay. We'll be able to make up the difference over time. And I also think that COVID has kind of been not like it's, I guess it is working against us, but when all of these changes happened, normally these changes might be implemented over a long period of time where you get your community used to it. You can put really robust communication plans together. You can share information. You can get community buy-in, you can hold town halls, you can do all of these steps. But we didn't have that option during COVID. And then there's also the challenge of shelters all over the country are different sizes. They have different resources. Some shelters have huge communication teams that are able to put graphics together and get things together. And there's been shelters too that have been significantly impacted by COVID in their shelter. I just reached out to El Paso and her name, Paula, I think her name is escaping me, but she said that her team is intact, like her team is holding up, but there's not one person that works there that doesn't know a friend or family member who has gotten sick or died. And it's just horrible because you're, again, not dealing with this tremendous amount of stress and loss all at the same time. And I don't know who said it. Somebody said we're better than this. And I have to agree that this year has really brought out the not so positive traits, I think, in most of us. It's just been really challenging. And we keep saying it'll be over soon. And we're like, when will it be over? And someone said the other day, and I think it's kind of an interesting, I'm part of a different organization. I sit on a board, and someone said, we've had challenges with COVID and changing policies and really have a whole buy-in. There's not a whole buy-in on those policies. And this man wrote us all a letter saying, I think that we have to, we skipped a step. We went through this, we adjusted really quickly, we put new processes in place, and we moved forward. But he said we never took the time to grieve what we were losing. We never took the time to really honor that we lost something in COVID. I know you and the boys have spent, I can say you and the boys, and that would encompass your whole family. But you guys haven't really left the house in months. That's a loss. That's like a loss of Halloween. There's just some really, we've kind of put our heads down and we barrel through this, and we're going to get through it. But there's an honoring that needs to take place that, we're all kind of grieving, scared, hopefully slightly optimistic, all at the same time.
And don't you think our, at least for me, we have essential staff, and so they have to come to work, and they're not behind a computer in their home, most of them, and so understanding the mental challenges that go into being a part of that essential work crew, it's very difficult because you don't have a lot of options. You do need to get in front of people. And I think the more that we can respect those people, the safer their environment can be and the less stress. I know for us, I think we've just kind of now we're just used to it. Like now we're just in a system. This is how it is. This is how it works. But it is emotionally draining, and it's hard when people are essentially being given permission to be mean. And that's
Right.
how I feel our platform is working right now, is that we just have permission to be the worst of ourselves and to treat other people poorly. And I'm hoping that over time that will change, that, you know, I don't know, that and I think too, I mean, honestly, my mantra in my head right now is just asking, is this going to make people feel? I think if we ask, we don't have to change how we're like what we do, but it might change how we do it. And so, you know, yeah, we don't have time to launch a ton of campaigns as far as, you know, focus groups and finding out how people feel. But just in how we make our changes moving forward, if we can ask ourselves how the various stakeholders or audiences that we interact with, how they're going to hear a message and how that message might make them feel, then maybe we'll get less pushback from our community when we're trying to do things. But that's my marketing side of me, like the branding side of, you know, how am I going to make people feel?
Yeah, that's good though. I mean, I think, like, I can tell you that we made changes that were, I think if we had asked ourselves those questions and focused on that, then the outcome could have been different. Though the problem is that what we had to do doesn't change. It was more like how we communicated it. And sometimes, frankly, you'll communicate it the best you can, and there's still going to be people that are, just going to come after you. So we can only do what we can do. The other thing I think that we're seeing, at least, is that the more that people are disconnected from humans, like I had a really bad day and I decided, so food is, as you know, my thing. Like if I need to be, you know, lifted up, I will go get something that I really like. And I went to go get my favorite breakfast burrito, and I hadn't been there in months. And when I walked up, they said, Mandy, and it made me feel really good. And I thought, oh my gosh, like this interaction, I'm depleted. Like I really am lacking. Like I still go into work most days for a few hours. I'm around the same people, but it's these random interactions where I really get to see people and humans. And I think that the more that we're at home and the more that we're segregated from the general community, we're dehumanizing people. And we are able to attack them without recognizing that there's a human on the other side, and that's a person that could have lost a family member, that could have a family member that's sick. There's just all of these factors that are happening in people's lives. I mean, there's so many people who are unemployed right now, and there are so many people who are freaking out because they can't pay their rent or their mortgage. And what is going to happen when the moratorium is lifted on evictions? I mean, that's in a few months, and it's right around Christmas. Like there is an immense amount of pressure and stress happening right now in the world, whether you feel it. Like I can tell you, I didn't recognize it myself until I had like a mental breakdown. And then I figured out that, wow, there might be something going on. And I'll just give a little PSA for everybody. If you're ever in a really bad place and you're stressed out and you don't feel like you're coping, and you know you can't breathe, your heart won't stop beating really fast, you want to crawl under the blankets all day, go visit your doctor. There's drugs for that. They make a really good difference and a good impact. And I'm owning it and telling people about it because I think it's important. And I had a little bit of shame around actually needing something, because I've always been like, I can handle it. You and I both, like, we got it. But now that I've been on something for a while, I'm like, ooh, I feel my serotonin is up. I feel good. So go visit your doctor. Don't be ashamed. And you can email me and say, Mandy, I did it. I went and got on something to help me manage and cope, because we need our animal welfare people to be strong and together, so that we can get through this. Well, it's been lovely chatting, Melanie. Do you have any final words that you would like to share with the audience that don't involve drugs?
I do think that it is a little scary how quickly I think dehumanization is an important thing to point out. And that anytime any of us feel like we're better than somebody else, we need to take a good look at why we're thinking that. Because you know what? All of us are really the same. There's lots of things about us that make us unique and special. But in the end, we laugh at funny things. We cry at sad things. We feel sorry for ourselves and for others. And it doesn't matter what country you're from or what language you speak or what you look like. In the end, like children are children, and they love their parents. And I mean, it's just this kind of dehumanization and pitting people against each other, and Republicans thinking that Democrats are evil, and that, and vice versa. These are really not and shouldn't be good, acceptable ways of acting. And so I think when you can dehumanize somebody, and then that's when the worst of things happen. That's what the military does when you go to war. They get the troops to not look at the enemy as humans anymore. And so then they can do terrible things because they are not worth, the lives that they're living. And so it's a dangerous path for us to be paving. And I'm hoping, honestly, I'm hoping for change, that we can be positive and become human again. This isn't about Republicans or Democrats. This is just about humanity. And so I'm hoping that 2021 will be positive, and that we'll find ourselves again and realize that we don't need to be so hurtful and mean. And that if we don't like something or we don't believe in something, to pick up the phone and get the facts. Doesn't mean that you have to agree with them, but at least understand where someone's coming from before you make up stories and attack them. I don't know. I think our industry is in jeopardy of losing some really incredible people because of how they're being treated. And that would be a shame, because if we really care about animals, then we want the right people fighting for them. But if we're going to be mean to everybody all the time, then why would we ever want to be working in the industry? So I'm hoping for change.
Yeah. And I would just say that for any shelters and shelter leaders or rescues that are listening, it starts with us. And that means being kind to the shelter down the street, being kind to the rescues, really looking at positive intention, calling and seeing how you can help, or talking to them about what you perceive as not being an appropriate way to operate. Just find out more information, because the more that we belittle or each other, we're really putting everybody in a bad place. And then the other thing is that fear is very, very powerful, and it is really easy to manipulate people and communities based on fear. And if we are trying to change the behavior of people in our community by high return to owner fees and tickets and all these punitive measures, we're really not creating an environment that we want, because it's led by fear. We need to instill I think equally as powerful is hope, and put those messages out to the community that are more hopeful, more positive. And it starts with us. So we can get out there and make a big difference just by making a few changes in our behavior.
I agree.
All right, everyone. Thanks for listening. You've been listening to People Are Animals Too. Darn it. My guest, Melanie Sadek with Valley Humane Society. Thank you so much for joining us.
No problem.